Nobody else do it like we do. Super FM 88.5 to the world. From the streets of Sufre to the world. We are 88.5 Sufre FM.
Your voice, your light.
The baddest.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Super FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Super FM, tell a friend, call your neighbor. Casualty 911 is on.
Of course, now 5 minutes after 10 in St. Lucia and the rest of the Eastern Caribbean. Let me say good morning to you wherever you are. Hope you're having a wonderful morning. It's the start of a brand new week and, of course, with brand new opportunities. Good morning. And it's 10 a.m. After between the hours of 10 a.m. and 11 is Casualty 911. And I have Miss Wilson here with me this morning. Good morning, Miss Wilson.
Morning, Romanus. You seem to be forgetting my name every time.
No, this time I forgot the first name. All right, Miss Louisa Wilson.
Mm-hmm.
So welcome, Miss Louisa Wilson. Welcome.
Morning.
Again.
How are you?
I'm good. Just a bit tired from the weekend, but I'm holding on.
Which is quite understandable. I'm a little bit tired too.
Okay.
However, it's good to be alive.
Yes, definitely.
Yeah. Let me just say good morning to all our listeners. And today we're going to speak about food care. Okay. And as you know, today is Diabetes Awareness Day, November 14th. And our theme for today is Education to Protect Tomorrow. And we want persons to be educated about diabetes so they can prevent, and if they are diagnosed with diabetes, how they can get proper treatment, continue taking their medication how they're supposed to, continue eating healthy, and do what they have to do so that they can keep it under control. Right, Romanus?
Yes, definitely.
Let me just say good morning to MNC. I know a lot of people have been saying, always say, not even...
you have to big the people up, the people that listen.
Very much so. So, MNC staff, Miss B, Sherry, Everista, all persons at the staff at MNC, let me say a warm good morning to you. Our market vendors, our caregivers, the general public, our persons at Connery's who listens every Monday. We must say a special thank you. And just to our general public, taking time to listen to our show when they can, and so on. So we want to say thank you so very much. We hope as time goes by, you can give us more feedback on what you'd really like to hear on the program and so on. And
you can actually call to ask questions and give your contribution 459-7885, or we have the WhatsApp 730-5388. And you guys on Facebook, good morning and thank you as well for watching and listening. And you can also comment and ask your questions. And of course, Miss Wilson will try to answer as best as she can. If she cannot answer, she'll go back and do some research and bring the answer back to me, and I will share it with you. Right?
Yes.
Yes.
Very much so, Rome. Let me just say, last week we spoke about diabetes, and we spoke about some of the issues with diabetes. We asked persons the small things that they can do to prevent and control diabetes, like exercising daily, eating your fruits and vegetables, making sure that you take your medication the way it is prescribed. And if you're having any problems with the medication, speak to your pharmacist, go back to your doctor who prescribed the medication for you. We spoke about quitting smoking and controlling your drinking. We spoke about many things that, a lot of people practice, and even when they're diagnosed with diabetes, they don't stop these lifestyle habits. They want to continue the smoking and the drinking. But these are not healthy things, when you're diagnosed with diabetes. So today, one of the things I've been observing, being at the hospital and the wellness centers, is persons are having a lot of foot ulcers as well as amputations of the toe, the foot, and so on. And we're starting to see that a little bit more.
Yes, you walk the street and you see a lot of people with a lot of amputees.
So, since I could not get a specialist to come and speak to you all today, so I'm going to try my best. So most times I'll be reading and not discussing.
Okay, and I'll be listening.
So, and let me just say that it's really, really sad because when you lose the toe or the foot, it can really play on your psyche. And a lot of people don't understand these things. And you have to be mindful what you say to these people when you see maybe their toe is amputated or their foot, or you see signs of they have foot ulcers and so on. Be careful what you say to these people, because these people are going through a lot already. Whether they were compliant, whether they were non-compliant when it comes to their medication, their eating habits, and so on. You just have to be mindful what you say to them, because a lot of people go through that pain, that psychological effect, and you want to provide a level of support to these people and not try to hurt them even more. Because if you're already dealing with an amputation, you think you want to hear a negative comment?
Exactly. Because, and it's a whole lifestyle change, because, you're so accustomed to having both legs and now you have one. So it's a whole, you're trying to adjust, and then, persons are probably saying negative things, all those things that they would say. Yes.
So all of these things you have to be mindful of. You can tell a person, précaution, you can say a little positive thing, toujours check doctor, something like that you can say to the person. But like what Romana said, these are not comments that you say to these people at that point.
Yeah, but I think that is why we're here today, to educate them and to how they can
educate to protect tomorrow, right, Rom?
Yes.
So diabetes, as I said, sometimes it's a lifelong condition and can cause a lot of foot problems. And some of these problems can occur because of the nerves and blood vessels supplying your feet are damaged. So many times people who are diabetic have a lot of foot complications, and they lose that sensitivity in their foot. So, for example, you see around the ankle get black, they get poor circulation, they don't feel when something prick them, and all of these things. So, if you're already having these problems, later on we will tell you exactly what to do. So, if your nerves and your blood vessels in your feet are damaged, it can affect the feeling in your feet. Like I said, you don't feel if something prick you under the feet, you start getting poor circulation in your feet. So once you see these changes have started, it's good to come and see the podiatrist. The podiatrists have different days at the different wellness centers as well as Sofre Hospital. So you can always call to make an appointment to see the podiatrist. Now, one of the things you see a lot of people have is foot ulcers, diabetic foot ulcers. And let me tell you, you see it all the time. You see people with the big buns, the wound dressings on their leg, their feet, and so on. And that's a clear indication that they're having some issues with their foot or their leg. So most times persons have foot ulcers. And what that means is the area of the skin has broken down and the tissue under it is now exposed. So if you really look at somebody with a foot ulcer, most times it is well bandaged and so on, but you really see deep down. You understand? You don't just see a cut, or you don't really see, you see like a round shape kind of thing, and you actually almost see like the flesh of it.
Wow.
So you have to be so very careful when people have foot ulcers. That is why they always keep it well bandaged, dry and clean. So when you have a foot ulcer, because don't forget, when you're diabetic, remember last week we said the wounds don't heal easily. So if you don't take care of it, it starts to open up a little bit more and get the area a little bit more affected. So more and more, if you don't take care of it, you see just kind of worse. Thank you. So it becomes more severe, and that's when infections start coming in. All right? So by doing that, one of the things you have to do now when you start seeing foot ulcers is, one, make sure that you continue coming to the podiatrist to ensure that you maintain the time, and you have to come and do your dressings on time. Persons who have foot ulcers, it is wise that you, if you are smoking, to stop smoking.
But that is difficult, you know. It's easy to say, but it's not that easy to do, because it is an addiction.
It is.
So to quit that addiction, that is a whole different topic that we're speaking about.
We spoke this year. We spoke about
Addiction.
smoking. Oh, we didn't speak about addiction. We talked about smoking. Let me say this. It is very difficult to stop smoking, but don't forget, you have to assess the risk. Is it more important that you continue smoking, or you're more concerned about losing your leg or your feet or something, and therefore you're so dependent on somebody? Quitting smoking does not happen overnight.
Yeah, it takes some time.
It takes time. For example, if you are smoking like one packet of Viceroy, now you have to learn to start smoking like half a packet, and eventually gradually get. And you have family and friends, you can go to the doctor, speak to them. There are the gum, there is the gum now.
But I think the main issue is withdrawal symptoms when you try to quit.
And
so
that
do we have any facility here in St. Lucia or Suffer that helps
substance abuse can guide those persons accordingly. There are persons that are trained for that.
Okay.
So these persons can really assist. Also, most probably you might need to go for a level of counseling, and the mental health team is available at our wellness centers, and the doctor can prescribe something to help. You understand? So it has to be something that, you know, it's a team effort, as well as how determined you are to actually quit. But other people have quit smoking before, and some people cannot. But after a while, when you're in...
It is possible. There's no taking away from that.
I've seen people...
It's not easy.
It's not easy. I've seen people who have smoked all their life, and when they really get sick, the body kind of rejects it. Because even if when you try to smoke it, you can no longer smoke.
Oh, that is perfect. That would be a perfect
So,
solution.
I mean, and that is person that are really, when they really get sick. Imagine that. All the time you say you cannot quit, but when you start really getting sick.
When you don't have a choice, you don't know how strong you are.
And so when you are at the hospital for about 2 weeks, you don't have a cigarette at the hospital.
That is a good point.
So that is the ideal time for you to tell them, you want to try quitting, so that they can really help you out.
Oh, okay.
A lot of people, I mean, once they go home, they want to go back into that same behavior, but
probably
really
probably is the environment, probably something in the environment, reminds them. Yeah.
Most probably. I mean, my dad used to smoke, and he quit. A lot of people used to smoke and they quit. I mean, it's just, some people just say after a day. Last week, when I came from the show, I met a gentleman outside in the balcony here. And he said that day he was just speaking to his friends, and he just decided to quit. I mean, We were just speaking after the show. He said he was listening to me and he was just saying how he quit smoking.
Okay, wow.
So if you're really determined, you can quit smoking. So that shouldn't be a problem. Yeah. But some people have more willpower than the other.
Than the other.
So, let me just say, if you already have a foot ulcer, how to look after your diabetic foot ulcer. Do not touch the dressing unless you have been properly shown how to remove or replace it. So a lot of people, they want to do it at their homes. But that's something you have to ask your health aide or your podiatrist to teach you how to do before you start doing it on your own. Or a lot of people adopt it on their own and they feel they can do it on their own. No, you must do that. Rob, you play? And you have to continue checking your feet every day for danger signs, for other problem areas. So if you already see you have the foot ulcers, you have poor circulation, you have to continue checking your feet. All right? And some of the danger signs, and I want persons to pay close attention to the danger signs when checking your feet. If you have new pain, or it's throbbing somewhere else, or if your feet feels hotter than usual, or you have new areas of redness, inflammation, or swelling, if there is any discharge, or there is a new smell from your feet, or you have flu-like symptoms. So, sometimes you have an ulcer, but there are new other danger signs that you might be needing to look at, because you never know. Because don't forget the poor circulation. By the time you see one ulcer another place, there is that high possibility another one is developing, and that is what we need to do. And we need to check our feet regularly every single day. And if you have dressings, do not let the dressings get wet. You must always keep it dry, and the wet dressings, getting the dressings wet may prevent healing and allow bacteria to enter the ulcer.
Okay, so if you're taking a shower, that means you have to tie your legs
tight up with a nylon or multiple.
Okay.
I don't see they put any like waterproofing on the dressing. I do not know if they have it here.
Probably that's something that we can look at.
That's true. Come to think of it.
Because I'm sure there's a better way than just tying your leg with some nylon. There must be a better way.
There is something.
There must be something else that is designed just for that.
Yes, there might be, but can our people really afford it? Or many times what I've found is that we tell people about the things, but we don't really know people's circumstances and situations, some of us. Whereas some people can go online, research and order one, but some people it's not so easy. You understand?
Yeah, but in comparison, how expensive it is for someone here with diabetes? Because I know in America it's very expensive, especially to get the insulin and those things. Persons are dying because they cannot afford it. But I don't think it's that expensive here in St. Lucia, I think. Is it?
No, government subsidize. So the diabetic medication, as long as you're diabetic and hypertensive, you get it free of charge.
Wow.
I was supposed to get the pharmacist here with me today, but it's a pity. He's the only pharmacist in the region. Wow. So it's really, really tight. So young people out there who have interest in studying, I mean, that is an area that really needs
Probably that's something I can probably go into.
Lord have mercy. I think you've already found your passion.
Okay.
So, so that's one of the things we found, the non-compliance about the medication. A lot of people don't take their medication the way they're supposed to, or they just come every week, come and take their medication, and it's piling up at their homes. So all of these things, the insulin, they get it, and so on. Even if you get the insulin, are you taking the
Are you
insulin?
taking it?
And so on. So these are things we really have to be mindful of. So let us not stray from the topic. Thank
Yes,
you.
let's-
Once I'm
No,
with
no,
Romanas, I'm always straight.
No, it is still part of it, you know. It's
It is still part
it's-
of it.
It's just a way of understanding because I
Yeah.
know I've seen documentaries where there are people in the US and those people are dying because they cannot afford the insulin.
The insulin.
So it's amazing that here in St. Lucia that it is free. That is just amazing.
You can go to as long as you are diabetic and hypertensive, I think government subsidize.
All right.
And many times, you know, the medication cost here compared to overseas is so different. I mean, you hear your friends and family members say it. Sometimes, I mean, there are certain things they ask you to buy up down here,
Down here and send
send
for
it
them,
up for
yes.
them. So a lot of people think up there is easy, but it's not so easy.
All right. So let's go back to the topic.
Thank you. You see you? So you have to moisturize the surrounding area of your feet. If your skin is dry, apply moisturizing cream every day. Avoid creaming the broken skin area and between your toes. And the reason between your toes is between your toes are always moist. So you don't want, if anything, that you apply the moisturizer that makes it even softer and so on. Do not stand or walk on the affected foot. So if you have a foot ulcer and they keep on telling you, sit, put your feet up. But yet you see people everywhere, every single day, walking everywhere. You understand? You're putting more pressure on the wound and on the feet, and that prevents the wound from healing. So when you put your feet up, it allows the wound to heal faster. And people tend to say, oh, yobopo koyo, when is that fair? And you know, but there are times you can really sit and put your feet up. It doesn't have to be all the time. So if you have a foot ulcer, we're asking you to be mindful of all these things and make sure that you do what you're supposed to do. All right?
All right, but just to be sure and to clarify, because when I was growing up, I was of the impression that it does not heal. So now that you saying that there is a possibility that
Yeah,
it
of
can
course.
heal with the proper care.
Yes, I've
Okay.
seen many people foot ulcer heals properly. You know, when they have the ulcer, it's how they take care of themselves too. A lot of persons don't come for the dressing regularly or when they're supposed to. A lot of people don't eat. They don't control their diabetes. They don't eat right. They don't do what they're supposed to do. So the healing process takes even more time. And you see people have it for a lifetime. You say from donkey
I
years.
know persons that have had it, from the time I was growing up. So
And they still
and
have
they still
it.
have it. So
And a lot of people, when they first started seeing the ulcers, they tend to hide it and they didn't take any treatment. So when it really gets bad,
that's when they had no choice but to
so there are circumstances, and other persons might have other health conditions that even prolong the process even more. You understand? Okay. So let us get back to foot care. Okay, so we spoke about checking your feet every day. We didn't speak about washing your feet. You should wash your feet every day with warm water and mild soap, and rinse your feet thoroughly and dry them carefully, especially between your toes. Let me just say that a lot of people like to use, when they're diabetic, they don't look at the type of material that they wipe their feet with. It has to be soft cotton material. And, be gentle. Some people have this hard kind of material. That's not it.
Yeah, so don't use anything that will cut you.
We spoke about moisturizing and your toenails. Do not try to cut your toenails by yourself. Come to the podiatrist for them to cut your toenails.
They do that for you?
Yes,
Oh, wow.
there is a podiatrist available, not you, Rome. The diabetic people, they'll cut their toenails, ensure that they cut their toenails the right way, and so on. A lot of people like to cut their toenails by themselves. No, if you're diabetic, that is why the podiatrist is there, to make sure that you cut your toenails the right way. All right? Avoid walking barefooted. Outside, inside, in the bedroom, in the bathroom, you shouldn't be walking barefooted at all. Because once you walk barefooted, there is that risk that you might, something might prick you, a sharp object, or you can damage your skin. A lot of people feel weird. They say, oh, I'm in the house is clean. You might not be the only person at home or something, and something might fall. Even my daughter, I remember when she was younger, I was taking out the staple from the stuff, and she was so upset that the staple fell on the floor, and I did not pick it up.
Oh, so did she end up stepping on it?
No, because of in the family we have diabetes, and that's one of the things I keep on saying. Walk with shoes in the house. And she was really upset, and she said, Mommy, but what if that goes underneath whoever's feet and whatever, and these are things you have to be mindful of.
All right. It's now 10:13 St. Lucia and the rest of the Eastern Caribbean. We'll take a short break. I have a Solve a Pulse this morning, I believe, and then we'll come back. All right, we have a new program, Solve a Pulse.
Really?
Yeah.
What's that?
A few seconds of news. So we'll do that, and then we'll be right back.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Super FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
This is your Solve a Pulse News Bulletin. This is your Solve a Pulse News Bulletin with Janie Bonza.
The clergy of the Archdiocese of Castries held a study day on Wednesday, November 9th, with members of the Royal St. Lucia Police Force. The session, which was held at the Beacon Restaurant in Soufrière, forms part of the Catholic Church's continuing initiative to show support for the Commissioner of Police and the Royal St. Lucia Police Force in the fight against crime on the island. Archbishop Gabriel Malizer explained how the police and the church can work together.
And thank you all for coming. We are here to really look at, to help us journey with the question of the crime situation in St. Lucia.
Deputy Police Commissioner Wayne Shari spoke to the challenges being faced by St. Lucia due to its geographic location.
Drug smuggling, drugs trafficking, firearms trafficking, and of course, human trafficking. So due to our position, Martinique is to our north, and of course that's the gateway to Europe. So as you arrive in Martinique, you're already in Europe via.
ASP Curtis Roberts explained that the church has a huge role to play in assisting with the transformation of youth and steering them away from a life of crime.
We need you to help us with our young people. It was in demographic, right? Committing crime. But what we realize now, it is spreading to a different age group. We have a lot more younger persons involved in crime now. Where when I was a young boy growing up, the average bad boy and the average criminal was about 25, 26. You know, you see guys as young as 15, 13, wanting to be part of it. They are being recruited from that age. We need to recruit them from that age. The church needs to recruit them from that age. The police force needs to recruit them from that age. The other social groups need to recruit them from that age. You have, as clergy, I think you could do a lot for us. You can do a lot with us, and it can go a very, very long way.
The Catholic Church says it supports the mandate of the RSLPF to mitigate crime on Ireland.
This has been the Sulphur Pulse News Bulletin. Thank you for listening.
88.5 Sulphur FM presents Let's Connect every Tuesday from 5:30 p.m. with your host Reniata D'Souza. Also live on Facebook.
All right, welcome back. Thank you so much for listening for the 3 minutes after 10 a.m. In Solution, the rest of the Eastern Caribbean. Yes, the time is running quickly. We are here on Casualty 911, and today we are speaking about diabetes and educating for the future. Of course, and Miss Wilson is here with me, and she's going to continue with the program, educating us on diabetes and food care, and what you should do and what you should not do. And don't forget, you can call us, you can message us 459-7885 to ask your questions. WhatsApp 730-5388.
Okay, thank you, Romanus. So we were saying about avoid walking barefooted, and you have to check your shoes also, making sure that there is nothing has pierced the outer sole of your shoes, like glass, a pin, or a nail. And you always have to ensure that nothing has fallen inside your shoes, like a small stone. So before you put the shoes, you know you have to shake it and ensure that there is nothing inside. And you have to ensure that you wear proper shoes and not badly fitted shoes. So a shoe that will cause irritation and damage to your feet. Also, if you go to the podiatrist and you want to make sure that you buy the right type of shoes, you can really ask for her advice and she can guide you accordingly. All right?
Okay.
Now, if you know you have any problems with your feet, your diabetes, you have to stay away from buying over-the-counter corn remedies. It is not recommended if you are diabetic because it can damage the skin and create ulcers. So over-the-counter corn remedies, you have to stay away from these. And if you have hard skin or corn, do not attempt to remove it yourself. You need to come to the podiatrist for you to get advice and treatment. Okay?
Okay.
All of these things you have to do. As long as it has to do with your feet, you see cuts, bruises, blisters, corns, do not attempt it yourself. Come to the wellness center or the hospital and let them guide you accordingly. All right? Now, that is what I have to say on food care.
All right. What about the bush medicine? Should they stay away from bush medicine as well?
I didn't have the pharmacist there. I don't have the pharmacist there. Let me just say this. Bush medicine have always been part of our culture, and a lot of the things we use as bush medicine, we do not know the correct quantity to take it in. It's what has been passed on by our ancestors. They tell you 3 leaves, a leaf and a half, 2 young leaves, 1 young leaf, and so on. Nobody is telling you not to take your bush medicine or doing what you want to do. But in the event that you're doing it and it's not working out for you, or it's causing even more complications, that's an indication that whatever you're doing, you need to stop.
You need to stop
And
professional help.
yes, and if you're taking like your bush medicine and the doctor give you the medication, speak to the doctor about it. Speak to the pharmacist about it. Say, you gave me that medication for that, however, I am using that bush medicine, and so on. And let them decide or discuss it, and they can guide you accordingly. You understand? There is nobody will tell, because even if you tell persons don't take the bush medicine, they will still take it. So if you speak to the doctor about it, then he can guide you accordingly. All right? Does that make better sense?
Yeah, that makes sense. I'm just wondering, like, if our professionals believe in bush medicine, or are they just about the science? Are they about the medication that is manufactured? Or
it all depends on the doctor, the level of studies. I mean, the way they were brought up, raised, and so on. So they will guide you. Some doctors are all about the science. Some doctors have a different level of flexibility, and so on. So it all depends.
Okay.
Yeah. Everybody's different.
That is true.
Yeah, I still believe. I still believe in bush medicine and and these things. However, there is a limit to it. Yeah. So now I want to leave you with 13 essential health benefits when it comes to diabetes care. Now, I spoke about it last week, but I just want to re-emphasize for persons that are diabetic, persons that are pre-diabetic, persons who have type 1 diabetes, especially our younger people, and for persons, you have a family history of diabetes, and so on. So, if you know you are at risk, there are so much that you can do to help prevent. If you're pre-diabetic, remember you said if you're pre-diabetic, you can, there are things you can do
to reverse it. You can reverse it at that point.
At that point. If you're type 1 diabetic, what did we say? I never said upuyasa. I said that is a lifelong condition that you have to live with, especially at a very young age.
But you can manage it properly, and you cannot cure it. It's a chronic disease, but you can manage it.
Manage it.
Yes.
And that's one of the best things. And if you type 2 diabetic, you can still manage it by doing what you're supposed to do, right?
But you have to be very precise and very vigorous with it.
Very much so.
Diet, sleep, rest.
And exercise.
Exercise, the right balance of everything.
Very much so.
Yeah.
Wonderful. And what did we say about men with diabetes?
Impotency.
I never said impotence. I never said impotence. Did I say impotence?
Well, along that line, erectile dysfunction. Dysfunction, yes.
Very much so.
It's one of the things that, makes the men run to the doctor, at the very last minute.
Not very last minute. So, the essential health benefits, and you have to get your blood glucose level measured at least once a year. So your HbA1c, that's the blood test that tells you about your overall blood glucose control. That's not the one where you go at the wellness center and they just prick you. That's the one you go to the lab and they actually do the blood test for you. So the HbA1c, you get that blood test done at least once a year. Then you have to have your blood pressure measured. And many times persons that are diabetic, blood pressure and cholesterol follows right,
Okay.
And that's one of the things you have to be careful. So your blood pressure, and you must have your total fat, such as your cholesterol, measured every year. So if you're diabetic, you must go and do your blood cholesterol test. And I think we said that last Monday. And you must go and get your eyes screened for signs of retinopathy every year. Now, there is the retinopathy clinic at Labry every Thursday. So if you're diabetic, that's one of the things you can speak to your doctor about, to go and do to the clinic. There is a diabetic retinopathy clinic to check your eyes and get your eyes screened. All right? And I know a lot of the health centers, the wellness centers, they organize for persons that are diabetic. They normally go in groups to go to that clinic. So if you have any wellness center close to you, you can always speak to the nurse at the wellness center and ask her when is she organizing for a group to go, and then you can always, go with the group. One of the things is that when you go to these clinics, it's always wise to bring somebody with you, because the thing that they're using to dilate the eye, it takes some time before you can actually see again.
Mama.
So it's always wise to go with someone. What do you mean, Mama? You're making people afraid.
Okay, yes, it's not that bad.
It's not that bad, because what it does is that it's a special digital camera is used to take a photograph of the retina that's at the back of the eye, and the specialist will look for any damages or any changes.
Okay.
So that is very, very important.
Would there be a cost to that? Do you know?
I think it's free, but I can always find out. But I think it's free.
Okay.
The Diabetic Retinopathy Clinic, that's at Labry Wellness Center every Thursday. Now you have to call. You have to call first. You just cannot just come to the clinic. You have to call and make an appointment. You need to have your feet checked, and that's one of the things we said. The skin, the circulation, the nerve supply of your feet should be examined annually, or if they see there are problems, that means you'll come a little bit more often. And if you have any risk of foot problems, they will refer you to the specialist, as the podiatrist or the foot clinic. You must have your kidney function monitored annually, and that's what I said the last time. Your kidney function test. You should have 2 tests of the kidney urine, tests for proteins, for signs of possible kidney problems, and blood tests to measure the kidney function. So when you do that, at least once a year, you must have your kidneys checked. You must have your weight checked and your waist measured. Remember we said that last Monday?
Yes.
And what was it, Romanus?
I cannot remember this one. There's something about the waist.
The waist circumference.
It must be below a certain.
Men below 40, I think, and women below 35. I can't recall myself. I was just testing to see if you can remember. Yeah. So your waist circumference is like when they measure around your waist and so on. So you have to be small in waist, right?
Yes.
Don't have a big belly. So you have to check your weight and then your waist measured. Also, remember we spoke about the BMI, your body mass index. That is your
the nutritionist would be the one
to do this for you.
Yes.
To tell you if you good weight, normal weight, obese, or overweight. And many of us fall in the bracket of,
I think I did that once, and the nutritionist told me I needed to lose some weight, but I look fine,
You look
and I know for sure that my waist circumference is below 40.
Oh, because your belt size is what?
It's 40 now.
Oh,
about 38. But I wear 40. But it's about 48.
Okay.
Sounds like a lot, but anyway.
It sounds like a lot. So your ideal BMI should be between 18.5 to 24.9, and your waist, the male should be less than 40 inches, and female less than 45 inches, right? So that is the ideal. And when you go to the wellness center, look, I have my card with me. It's your wellness record card. And one of the things that they do is that they check your weight, your height, and then they gave me my BMI, which doesn't look so good. But then at the same time, they tell you what your body fat is, your visceral fat, and all of these things that you can really work on.
You know, growing up, that is something that everyone had. You know, this little they call it the book. There was a name for it. I don't know the name. Huh? Yeah, and every time you go to the doctor, you know, you have your little book.
Yeah, but they still do it.
Well, I don't even know where my book is.
but you don't come to the wellness center. Most probably you go to the private doctor.
Yes.
Or you don't get checks at all if that's the case.
I do my annual checkup.
Okay,
so everything is on the computer. So when I go to the doctor, you know, he has everything there.
Oh, okay. Well, that's very good.
I think the wellness centers now have a new system where they have everything on the computer as well.
Yes, they do.
And that is good. Because sometimes you might go to
HMIS.
Yeah, you might go to one in Etanks, and then you go to, now I'm living in Choiseul, so probably I go to the one in Lafayette, but the good thing now is that I think they have all the information there.
Oh, so even if you go to Itang Sufra Hospital, wherever you go, the information is right there.
That is good.
That is very good.
Because there are people, you know, they have conditions where sometimes they're not sick, but they feel like they're sick, so they go to Etanks, they get medication, and they want more of that medication, so they go to Lafayette.
Really?
Yeah, there's different conditions, you know. Sometimes people get addicted to medication, so they shop around.
That's true. A lot of people.
Yeah,
some people do.
So it's good that the records are there. So.
Well, that was never.
Mental problem.
Yeah.
All right, let's continue.
And number 8, get support if you are a smoker, and if you have a friend that does that, Rome, you need to speak to them.
No. I'm just. No, I honestly don't know anyone that does that.
Thank God.
It is something. It is possible.
A lot of persons use different medication for different cocktails and different stuff too, and that's the avenue they can get it. Whether we want to admit it or not, these are things that really, really happen. So we have to be mindful. And
another reason that it is good that they have the record, because you could have been given a medication, at Eaton some time ago, probably 2 weeks ago, and now you have some symptoms. You went to Lafag, but now the doctor can trace back and say that, okay, those symptoms are probably from that medication that you got. Yeah. So it's good that they have the record.
That's true. So they said number 8 is if you're a smoker, you need to get support, and that's one of the things we were saying. Knowing that you're smoking and you have diabetes, it increases your risk of heart disease, stroke, and it increases your risk for other stuff, health conditions too. So that's one of the things that you must do. And if you are diabetic, you have and you should take care of yourself and have a yearly plan. There are things that you have to do yearly, like all your tests, everything, and you should have a yearly plan so you can have some self-care. All right? And number 10, they say attend an education course. And right now, I can tell you we have the chronic self-management course that we're offering. Anybody that is interested, they can always come to me. It teaches you how to live with chronic diseases. Now, you don't need to be, even if you cannot read, write, but that course is so important, I can tell you. Even if you cannot read, write, it's a 6-week program. I think it's 2 hours every week.
So how do I do it if I cannot read and write?
No, but the presenter will explain everything to you.
Okay.
They do it in both the Creole and the English, and they explain everything. So they teach you life skills. They teach you how to do certain things, how to measure your plates, how to do all these things. So it's a hands-on experience also.
Wow. And how often do they offer that?
If they have a group of 10 and so on, then they they do the program. It's small groups, not very big groups.
Okay, because it's hands-on. So
yes, very much so. So far we have our caregivers that are registered, so hopefully next year they will be doing the program. So these are the first group that we're going to have next year. And it's something that a lot of persons need to be trained in, yeah. So, and you need cares from different specialists. If you're a young person, you need to receive special care from your pediatrician. You have to ensure that type 1 diabetes is really taken care of, and you have to help the kids out, because children tend to falter. They want to do things that other children do, eat what other children eat. So you really need that kind of support. And don't forget, you have to ensure that you see your healthcare professionals if you're diabetic. Take some opportunity to see your dietitian, your nutrition, your podiatrist. These are the persons that can guide you through it. All right? And you need the psychological support. Number 13, you need the psychological support. Sometimes you're diabetic, so that's a long-term condition. You need that kind of counseling. Many people do not know how to live with diabetes. It can be really frustrating. It can be, So, in the event that you're diabetic and you're having problems, or you're newly diagnosed, a lot of people are in denial when they're diagnosed with diabetes. And they will not do what they're supposed to do, and that's when afterwards, yes.
They don't believe that, the doctor is wrong. They want to get another opinion.
Yes, and so on. And they see the signs, but they're still in denial. So you need that emotional support and that level of counseling to help you get through it. And a lot of our young people are diagnosed with diabetes. I mean, not the type 1, but in their 30s, 40s, and so on. Men and women alike. And, because of the lifestyle, the heavy alcohol consumption, they don't sleep well. I mean,
mac and cheese. No, that's not a contributor.
Why you want to put it on mac and cheese?
That's for cholesterol.
Well, that too, because they don't eat right.
Yeah.
All these fatty foods that they continue eating, causing them to be obese. That's one of the risk factors.
Yeah, so it was.
Yes, and they don't exercise. I mean, they do things that they not supposed to. But when they're diagnosed, they tend to be in denial quite a bit. And then they tend to forget about everything and continue living the lifestyle until it's too late. That's when reality is striking. You're hearing people just staying and fainting, big.
Yes.
Passing out. And that's when the sugar is either really, really high. And then they have to go through that, psychological effect where they have to learn to accept it, whether they want to or not. And that's when, they really need the counseling and the emotional support. And like we said before, that is not the time to be bashing the person, but encouraging the person to do what is right.
Yeah, that is a time for support. And I think one of your points mentioned that they need the support.
Very much so.
Get help.
Get help. And that is why we have our mental health team to provide that support. It's not only for mentally ill patients, but to ease out that burden for some people that might, have issues that they really need somebody to talk to, and right. So on. Right. So these are the 13 essential health benefits that I want persons who are diabetic, who are pre-diabetic, or persons, you have diabetes in your family that you're really cautious about, and you want to make sure that you do what you're supposed to prevent, any chronic, not only diabetes, but any chronic illnesses and so on. So, do I have good timing?
You have perfect timing. We have 4 more minutes left, but I want to say, let me see. Good morning, Miss Wilson. Soufriere Environmental Health Officers are listening. Keep up the great work.
Oh, thank you very much. I must admit I am pretty surprised as a former environmental health officer myself. Thank you so very much.
For listening, yes.
Yeah.
All
They
right.
was up to no good.
All right, 3 more minutes. Anything you want to leave our listeners with?
Very much so. I want to encourage persons to come to our diabetic and hypertensive clinics at the different various wellness centers and Sufre Hospital. I want, when you come to the diabetic clinic, to engage the nurses, engage the CHAs, engage the pharmacist in questions, or the doctor in questions or concerns that you might have. A lot of people come and they just accept what they get, and they don't really, it's when they go out their home, they have all their issues, that's when they come and they complain. Another thing I would like to say is, if you come to this clinic, bear with patience. I mean, you come to this clinic, some people just want to come to the clinic, get their sugar test, get their medication, and run out. I mean, there are persons with different conditions. If everybody keep on complaining and the doctor just come and just give you medication, go back at your home, I mean, it defeats the purpose of coming for medical care. It's just not the medication and checking the sugar and going back. You have to sit, you have to take time and respect other people, because at the same time, somebody might have concerns, but because you're there quarreling outside for so long, they bombard the person, I tend to shy away from having a discussion with the doctor.
Yeah. Sometimes they want to tell the doctor that the medication not working, but
exactly. So bear a little patience. I mean, that's what you come and do. And a lot of the persons that are at these clinics are older folks. You understand? These are persons that are not really employed and so on. So they have a lot of time on their hands and so on. And bring something to eat. So you cannot say you're hungry and you want to go back at your home. Another thing, I want to encourage the younger people that are now seeing signs that, come to the wellness center, speak to our nurses. You don't have to come to the diabetic clinic per se. But if you're starting to see signs, come and check your blood sugar, come and see the doctor, and let them guide you.
I did not hear you mention, I don't know if I'll pronounce that word right, neuropathy.
Oh, diabetic neuropathy?
Yes.
Well, I did not mention it per se, but I did speak about the nerve and blood vessels issues in the...
No, but with neuropathy, it is one of those symptoms that you really cannot ignore, because you will actually feel that warm feeling or that tingling feeling or that pain
very much
in the
so.
leg.
I did not speak about it because that's not my specialty.
Okay.
But that is true. Diabetic neuropathy, I've known some people that really, really suffer from diabetic neuropathy. And they tend to feel it's something, but then after a while, when the nerves start losing all that kind of stuff, it really have an effect on them, especially their leg. And people don't understand that. Maybe I need to bring somebody to speak about diabetic neuropathy.
Yeah, and it's not only diabetic neuropathy. There's a lot of other things that can cause that neuropathy. So
that is true, but that's one topic that we really don't hear people talk about. To tell you the truth, when it does happen to people, they're in a lot of pain. Some people.
A lot of pain, yes.
And I must admit, that's something I did not mention for true. But let's hope that people don't go through it and they start controlling themselves. And let me just say that with diabetes, there are some things that just come about, especially if you don't control it, like diabetic neuropathy for one. And people don't understand that. And the exercise, that's where the exercise comes in. It helps so much that people don't understand. Some people start feeling diabetic neuropathy very, very early. Some people, as they get older, they start feeling it. So these are things you have to be mindful of. The tingling sensation, like you said, and so on. But I didn't really speak into that too in depth for you. I'm prepared to give.
All right.
I tend to limit what I can speak about because that's not my expertise.
Yeah, sometimes you don't want to give the wrong information.
Yeah.
Yes. That
I try my best not to. That's why I try to get the specialists, but it's a pity. And another thing is we do not have many of the specialists in our very own communities, and that's a time to really urge the young people to go out there and specialize, because right now the podiatrist we have is from Cuba. We don't have our own local podiatrists, and these are the things. I mean, I know we're straying away from the topic, but these are things. These are the things we really need to. I mean, look at our community. What are the skills that are within our communities, and how these skills can benefit our community and persons with the interest? How can you nurture that interest and ensure that they pursue that interest?
I think they need to have some sort of educating, on the from the Ministry of Health, to say, these are the positions that we are looking for. These are the skills, because I've never heard of
the government priority list. Every year the government priority list is out, and they say what areas that they really want people to train in.
Okay.
They don't really have these kind of persons, and that is why I went into entomology, because that's one of the things that they were really asking for.
Okay.
You understand? On the priority list. And once it's on the priority list, they really help you pursue it, especially if you're already a public servant. I mean, there are certain benefits to it. But if, for example, you're a public servant and you're on permanent establishment, and you want to go and study something that is not on the priority list, you might not get that kind of support as somebody that is on permanent establishment that really wants to go and study something that is on the priority list. So if you go on the government website,
it is there.
You will get the priority
let me go
list
and see
every year.
What I need to go into.
Well, not what you...
what I need to study too.
Yeah, and that's one of the things. And let me just say that a lot of persons do not know these things. They don't know about these things, and that's one of our things. That's where our leaders come into play, and our superiors and supervisors at the workplaces need to teach, and then to bring the others up. It's not that they're going to take over, or it's not that they're going to be qualified more than you or anything of that sort, but it's to bring the young persons up to that kind of level. So the information is out there. Person just need to know where to get it, how to get it, and the people to speak to.
Okay. All right. Thank you for that information, Ms. Wilson. 5 minutes after 11, so I guess we got to end here. Let me see. Wilton is listening. Janice is also listening.
Oh, my God. Let me just say good morning to Janice, because she already said that in the early thing she will not be listening, but later on make sure I said happy and great good morning to her. She's one of the persons that always listens to the program. She's a very close friend of mine. Let me say good morning to you, Janice. I hope all is well. Do take care of yourself and have a great day.
Okay. Thank you guys so much. Miss Wilson does not want to leave today, but we have to leave.
We have to leave.
Yes. So until next time, thank you so much for listening.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic,